Hello, everybody, and welcome back to Plugged Into Public Health. Today, we're introducing some new voices to the podcast, our newest student podcasters. You'll be hearing from them a lot more in future episodes, so we wanted to take this time to get to know them, their backgrounds, and what excites them about public health. I'm Lauren, and today I'm joined by Max, Caroline, and Raj. And if it's your first time with us, welcome. We're a student-run podcast that explores major issues in public health and how they connect to people both in and outside the field. Now, let's get plugged into public health. Plugged Into Public Health is produced and edited by the students at the University of Iowa College of Public Health. The views and opinions expressed in this podcast are solely those of the student, hosts, guests, and contributors and do not necessarily reflect those at the University of Iowa or the College of Public Health. Well, thank you guys all for joining me on the podcast today. We have 3 of our new podcasters here, and I'm just going to to start out, I just want you to introduce yourself and then talk about what you do at the University of Iowa, what brought you here. Just give us some background on who you are, because this episode is to be introducing you to all of our listeners, because they're going to be hearing from you a lot more.
Hi guys, my name is Prithviraj Taleboina. I'm a master's student in public health with my concentration being epidemiology, and I'm a first year in MPH. And my favorite thing about public health, or what I really wish to do, is work more in the field of infectious diseases, and that's what I would like to do. I was going to pass out from my master's in 2026.
And then where did you move from?
I am from India. I'm actually a physician that's what I did in my bachelor's, and I was working as a physician for 5 years before I moved to Iowa to do my master's.
So you have some good clinical experience background.
Mm-hmm.
My name is Caroline. I'm a first year MS student in the Agricultural Safety and Health program, which is in our Department of Occupational and Environmental Health. My path to Iowa was a little untraditional. I worked for the CDC as a public health associate, and I got stationed in Iowa to work at the Iowa Cancer Consortium. So I moved from New York City to Iowa City, and after finishing up with the CDC, I fell in love with public health and Iowa, so I decided to pursue my master's here.
So it's safe to say you liked Iowa enough to stay.
Yes.
But that's a big move. New York City and Iowa City have approximately 0 things in common.
Yeah. I tell people that instead of hearing the J train at night, I hear choo-choo trains now, and it really freaked me out. But I love seeing stars here.
It's the little things.
But yeah.
My name is Max. I am in the Epi department, and I'm a first year MS student. I was born in Illinois, and my sister went to this school, and I visited it at the exact same time that she did, and I really liked it. I came as a biochem major, and wasn't really the right fit for me. So I started taking a couple public health classes my second semester, and I immediately just fell in love with it and switched over, and I've been here ever since. So.
Great. And did you do undergrad to grad?
Yes, I did.
Okay.
So I'm currently in my combined year for both of those. Going to be getting my bachelor's in May.
So then are you done after May?
No, I have one more year in my master's.
Okay.
Yeah.
Great. Well, I'm glad that we get to keep you around for another year. And then the other thing that I want to as kind of our introduction, what are you most passionate about in public health or in your field of study that interests you?
I would say, so I'm really interested in chronic disease, particularly with dementia and Alzheimer's, but I also really want to look into chronic disease surveillance and trying to get ahead on risk factors for chronic diseases, trying to make sure that we get ahead of the curve and get into some primary prevention strategies there.
Great.
So what's fun about the agricultural safety and health degree is that there's a lot of different directions you can go with it. And because my background is in cancer prevention and control, as well as food systems research, I've been able to combine all of my interests using a public health lens. So I'm interested in the health and well-being of the people that produce our food, and also as eaters, what's in our food. So passionate about just the knowledge and education and agency that goes into our food system.
I love that.
As I said, I'm actually pretty much into infectious diseases. That's where I wish to work because COVID had a very lasting impact on me. I was working during the pandemic, most of it, me and my family, most of us are physicians. So, and touch wood, I know things could not, I don't want things to go backward, like have another pandemic, but I think that we are heading that way sometime soon, at least from where I come from. And we are being the most populous country in the world, I really thought that working on infectious disease would be like preparing for something that can happen again and again with things going around.
Yeah. Do you want to go back to India once you're done with your schooling here?
I am still considering my options to do residency here before I go back.
Mm-hmm.
The final thing, what I really want to do is like set up my own hospital back in India. But yeah, it's gonna take some time for that. So
That is a good big goal. Now transitioning, since we're all graduate students, I wanted to give some advice to other graduate students that listen to this. So, what has been the biggest surprise for you guys about graduate school so far? Because it's a really big change when you go from undergrad to grad. And so, what surprised you?
I think the main thing that really surprised me, even though I was told this many times over, was that you should be treating like graduate school as like a 9 to 5 almost, or like treating it as a job. And I never really appreciated like the value of that and being in the building and being able to facilitate those connections by just showing up and being in person. So that definitely surprised me. I feel like compared to undergraduate our undergrad at the college, like there's a lot more opportunity to facilitate those connections with faculty. So
So, do you go to school every day for like a majority of the work hours?
I do my best. There are slumps, especially during like midterm seasons. I really like to study in a controlled space at home. I
Yeah.
often get distracted in the building, but when midterms come around, I'm definitely a bit more recluse. But during those like start of the semester, mid-semester, I'm definitely in the building as much as
Yeah,
possible.
I feel like I see you around all the time there. And I'm not even there that much. My other question with that is then, like, when you say you treat it like kind of 9 to 5, do you stop working like in the night and like do your own thing?
Absolutely, yes.
Really?
I find that very important. I think that's why during midterm season, I become a bit more indoors and back at home because I start to break that balance. And
Mm-hmm.
I find that I really need to be in that like comfortable environment when I'm working from like 8 to 8 on those.
Right.
So, yeah,
Okay. I think that's great advice. And if you are listening to this, if you can like set up your commitments so that you can follow that, I do think that that is really beneficial for long term, especially if you're in a longer degree program like a PhD. If you can make that happen, I do think you'll be better off in the end. Okay, Caroline, biggest surprise?
I was an international relations major in undergrad, so public health was brand new to me in an academic setting. So for me, the openness of everyone in the College of Public Health as someone with a non-traditional public health background and my confidence from undergrad to grad has it's changed exponentially. Like I was a very quiet undergrad, like I wouldn't go to office hours. I would kind of just do my own thing. But here I'm really taking advantage of like meeting with my professors and like Max said, networking and taking advantage of those connections. And I have found that that has been so helpful in classes where I didn't take undergrad, chemistry or bio, but I'm in human toxicology and classes that sort of require that background, but I'm still doing fine and I'm learning so much. Like I like to tell people, like whenever they ask me how grad school's going, I'm like, I can't complain that I'm not learning because everything feels brand new and exciting. So that's been really great.
I totally agree with that. I'm going on my third year now, and sometimes like it's exhausting how much you learn like on a daily basis. Because I think, and I don't think I'm unique in this, but the more I learn, the more I think you realize you don't know. And sometimes that feels overwhelming. So I'm glad to hear, like, it's good to have that perspective again that like learning everything is so great. And I need to remember that because sometimes it can also be exhausting. And that's kind of been my spot the last couple of weeks. But it is so great. You're right. Okay, Raj.
Building up on what Caroline said, I would just say that I come from a very different system from India. So one of the things I was presently surprised about was how open the system is for you to control your own education and how you could plan things according to you actually. What works for you, what doesn't work for you, what kind of pace you want to do things at. And the whole system is designed for more openness that you could talk to people of authority without be in a constant fear of being penalized or judged, which is really important, especially when you're doing your master's or when you're in grad school per se. And unlike Max, who says it's a 9 to 5 job, I must say I have been more of a night owl in the whole system till now. You will find me in the library like pulling all-nighters most of the time, which I don't advise, but I would say it's very efficient during midterms and finals.
I wish I needed less sleep during midterms.
Yeah, you need to get used to having less sleep in grad school.
Yes. Okay, so what tips then do you have? We kind of already touched on this, so if you have additional ones, you can share them here. But do you have any tips for balancing like coursework, research obligations, and personal life while you're in grad school?
I think that the main thing that's really helped me on the research side of things, at least, was that during my undergraduate tenure, I started research, and my mentor, Dr. Shannon Watkins, would often incite us to ask our own questions about her research topic. So while we're still under this overall study, we're being like asked to express our interests in what we're talking about. So that aspect of research and like really trying to hone in on what you are interested in and what you want to do if you want to continue research at some point. I think that's really important. And like relating it to your coursework is really important. I feel like you can really enrich the content that you're learning in your courses if you're also working with similar things in your experiences. So,
Yeah, that's great advice. Raj, did you have something?
I just wanted to say that of most of the resources that we will have would be very similar, but using AI in the right fashion would be really good for your grad school. If you don't see that as a tool to do your work, but as long as you see that as a tool to enhance your work or learn things or concise things for you, it's very helpful during grad school. And as long as you use it in the right way, it just goes with the system that you're in. But
Yeah.
if you just use it to do things the other way around, it's not going to work out for you. But
No, like
yeah,
don't have it write your papers, but it can be
yeah,
really
right.
great for editing,
Mm-hmm.
brainstorming,
Mm-hmm.
like all of the process that can like lead you up to like the point where you need to do the work and then like
Mm-hmm.
refining it afterwards.
Yeah, for me, it falls into two buckets. I think the first is organization. I'm a big planner girly. My calendar, like I live by it, if it's not on the calendar, it's not happening. And so that's been really helpful. And then with accountability, as a Heartland Center trainee for occupational safety and health, we have to do these work plans at the beginning of the year. And my advisor, Diane Rollman, who leads like the Healthier Workforce Center of the Midwest, who's really focuses on like total worker health. So it's like keeping workers, safe in the workplace while also promoting their well-being. She has us create our own little category on that work plan for wellness. So we're not just talking about, professional development or what courses we want to take or conferences we want to attend, but also like how are we taking care of ourselves throughout the process. And that's been really helpful because I feel like if it wasn't written down on that plan, I probably wouldn't stick to it as much. So that's also been really key for me.
I can also really relate to that. If it's not on the calendar, it's not happening. I like live by my calendar. And if you are a grad student, you need to like get that in order because you're going to have so many different commitments and meetings from like all of these different sources. And so having like one spot where it all converges, like I use a Google Calendar for like all of my things and I just have like my Outlook calendar like feed into that. And I highly recommend it because then I put like personal things on that one and then, other commitments and it all just feeds in. So I have one calendar. So I highly recommend that. We're going to move on to kind of talking about some more public health topics more broadly. So, what's an issue in public health that you don't think gets enough attention?
So I worked at the Iowa Cancer Consortium as a public health associate, and I still work there part-time leading their Cancer and the Environment Task Force, two very big buzzwords in the state. But for me, like through that work and then tying that into like my agricultural safety and health work, I would say health literacy, but in environmental and occupational health spaces is an underrepresented or understudied topic because we talk about health literacy in terms of like eating right or not smoking or not drinking as much, but we don't necessarily talk about how we perceive and act in the environments we're in and like how work affects that or how, the local park affects that. So that's something that I've become more passionate about just as I've lived in Iowa and, worked and taken classes.
Being a student gives you kind of a unique window into like noticing things. Yeah. And then being able to explore them further. Max, do you have something?
Yeah, I almost just I wanna bounce off of that in the health literacy aspect of things. I've been working with a professor at the College of Nursing on dementia risk reduction interventions in the city. And really a big problem there is just that a lot of people don't connect their mid to early late life like chronic diseases. They don't connect those with their potential for dementia diagnosis in the future. So like by communicating the true disease burden of the stuff that they are going through and at say 40 or 50, they may be more likely to change those behaviors given that they understand what those diseases may lead to in the future. So
And actually, something very similar to what Max said, like my work with Dr. Deshpande, and we are doing this root cause analysis, I've noticed that there's not enough emphasis on qualitativeness of root causes or diseases. Like there's a lot of material out there when you go out and see that people are getting quantitative data analysis so much compared to why something is not happening. Like if let's say transportation is an issue for one sector of the patients or one racial community, we never we get the statistics of it. We know how much percentage of it of people are getting affected by one reason, but we don't have or we rarely or relatively lesser intent of trying to know why or why that's happening to that community or how can we change it or what is the qualitative side of the whole issue. And I've seen that it's relatively a field of less focus in public health.
Turning now to the kind of, since you guys are all on the podcast, what excites you about being on the podcast? And what kind of stories or topics do you want to explore while you're hosts on it?
I think that something that really excites me about being on the podcast is just being able to meet so many really brilliant people, like just very smart people that are very specialized in things all across the campus and really all across the country, really. So that's very exciting prospect there. And also, I am probably gonna steal a lot of people's idea here, but bird flu is really on my mind, and I would really like to have an episode about that. But really also just infectious disease as a whole, given that it's not my interest per se, I still would like to be able to explore that in another route.
Love it. I do love like the networking opportunities in being associated with the podcast. Agreed.
So I'm pretty similar to what Max said. I'm really excited to be meeting people. It was a great thing that we met the vice dean of the med school the other day. It was a very unique experience. And the field I would really like, there's so much uncertainty that's going around in the field of public health right now. And I think I would like to focus on that during most of the podcast, say, because as we move ahead, I think people already are facing a lot of issues as they go out with their degrees and what kind of opportunities are going to be there outside. So I would like to know what lays ahead, and we should focus on that.
Caroline?
Similar to what Raj and Max said, I think storytelling is just such a powerful tool, especially in public health. when we're asking those why questions and looking to get more qualitative data. I mean, Lauren and I are both in the qualitative research methods for public health class, and I think that's been just so eye-opening. So just being able to talk to folks about their work and give them an opportunity to brag too, because I feel like public health at the end of the day, it just touches all different aspects of our lives, and having the opportunity to learn more about that and be more aware of that in podcast form, I think is a really great opportunity. So any chance to learn more about like grassroots community organizing, public health, I would be excited to explore that on the podcast.
I definitely agree. Giving people a platform to share their knowledge, especially if it's like in a storytelling fashion, is really powerful, and it makes it so much more accessible to a broad population because it really does affect us all. Distilling down, we've talked about a lot of different facets of graduate student life. What is one piece, like one tip that you would give people as they start or continue on with their graduate career from your own experience?
I would say, and by all means, don't overcommit yourself, but put your name down and sign up for everything. You can always say no. I think it's super important to get your name out there and take every possible opportunity that's thrown your way. If you find yourself overcommitted or with too much on your schedule, you can always cut back.
Mm-hmm. Yeah, I agree. Say yes to a lot of things, especially in the beginning, because you don't know what your own capability is at that point yet either. And so it'd be a shame to miss out on opportunities. And I would say that people are pretty flexible. Is if you realize you're overcommitted, people are willing to work with you, especially if you put in a lot of effort on the forefront. So agreed.
I would say have a life outside of your school. Do not over stress off on grades. Just if you burn out, you will burn out, and you would need to fall some. You need something to fall back on. So have commitments, have friends outside of your school, and yeah, generally have fun. Don't let grad school take that away from you.
In general, grades won't be on your CV. So
I'm gonna quote my mom because she always tells me what's for you will be for you. And I think I told myself that a lot when I first started grad school because the imposter syndrome was very real. Just asking myself, like, was this the right program? Like, am I in the right spot? Like, am I doing what I'm supposed to be doing as a grad student? Quotes. Because there is no like one set path as a grad student. So just, I think reminding yourself that you're where you're supposed to be, like you're in this program for a reason, you were chosen for a reason, and just take the time to celebrate and acknowledge how far you've come in the process is really important as you're learning all these fun new things and getting the degree.
great. What will be for you will be. Let's wrap this up with our question that we ask everybody, and that is, what are you reading or watching right now? Keep it lighthearted.
I was actually watching a documentary on Robin Williams and reading more about him as I work on my stand-up sets. Yeah.
Oh, fun. I
Yeah.
love that. He's a classic.
Yeah, he is. He is.
I just finished Queen's Gambit. It's a little old, but I really, really enjoyed it. It was very, very good.
It is really good. Is that like a one season? Like, did they ever talk about making a second one?
I'm pretty sure that it was just meant to be a limited series, but it was like
Okay.
really, really popular. So I
Yeah,
mean,
it was.
I don't know if they're gonna make another one or not.
Yeah. I really liked it. I watched that too. That was good.
I'm watching Bob's Burgers chronologically. There's a lot to go through. We're on season 7 now, which is really exciting, but I hadn't realized how much I had skipped around until finally sitting down and watching it. And it's just so good. The one-liners are amazing. I need to get the cookbook. Just Coochie Kofi for life. So it's bringing a lot
How
of
many
joy.
seasons are there?
Like 14, 15,
So you're set
plus
for
the
a while.
movie. Yeah, yeah. Probably after I graduate, like I'll still be watching.
I'm right now. I have the season finale of Severance to watch. I've been watching that. And then I also like love. It's a new show and it's called The Pit. And it's about an ER in Pittsburgh. That's why it's called The Pit. And it is so good. It's definitely my favorite medical show I've ever watched. And I wait every week for the episodes. So that's what I'm watching right now. I don't read for fun. I don't have the energy to read for fun at this stage of my life. I have to do too much reading for other things. So because for a while I spent a lot of time feeling really bad about not reading. And then I was like, but like Lauren, you read like hundreds of pages a week. It's just like not fun reading, you know? So I'm still getting the mental workout of reading. It's just like not for pleasure. And which is fine. That's just where we're at in life, you know? Okay. So anyways, that kind of wraps it up. And I'm so glad that everyone got to meet our new podcast hosts. We have 2 others as well that couldn't join us today, but you'll hear all of them, Max, Raj, Caroline, Tristan, and Victor on future episodes. So I look forward to having you guys as co-hosts and hosting your own in the future.
Thank you so much for having us, Lauren. It was great.
That's a wrap for today's episode. We hope you enjoyed getting to know our new hosts and hearing about their journeys into public health. As you heard, they come from diverse backgrounds, including epidemiology and infectious diseases, and they're excited to bring fresh perspectives to the podcast. This episode was hosted and written by Lauren Lavin and edited and produced by Lauren Lavin. You can learn more about the University of Iowa College of Public Health on Facebook. Our podcast was available on Spotify, Apple Podcasts, and SoundCloud. If you enjoyed this episode and want to support the podcast, please share it with colleagues, friends, or anyone interested in public health. Have a suggestion for our team? You can reach us at cph-gradambassador@uiowa.edu. This episode is brought to you by the University of Iowa College of Public Health. Until next time, stay healthy, stay curious, and take care.